So a question that comes up commonly when I do any of my cardiac or my pharmacology stuff is, why can't I give GTN to somebody if they've had Viagra within the last 24 hours? Or any of those erectile dysfunction medicines. There's a long-acting one, the yellow pill, inside 48 hours. We shouldn't give Viagra to these patients. And there's a simple yet complex reason why. First of all, let's understand how GTN, glycerol trinitrate, works. It works by stimulating nitric oxide. So your blood vessel walls release nitric oxide, and when they release nitric oxide, this causes relaxation. The blood vessel relaxes and dilates. So when I give GTN to a patient, it stimulates that process. So you get massive relaxation and dilation. And this tends to drop the blood pressure. So if you have a patient who has had some Viagra, what has happened is that you've given them a drug that is essentially referred to as a phosphodiesterase 5 inhibitor. Phosphodiesterase 5 inhibitor. And Viagra and Cialis and Levitra and all of those erectile dysfunction medicines, that's how they work. They inhibit this enzyme called phosphodiesterase. To understand the contraindication of giving GTN to this patient group, we need to understand what phosphodiesterase does. So, as your blood vessels release nitric oxide under the influence of anginine or nitrolingual at GTN, nitric oxide is released, and then phosphodiesterase comes along and it dissolves or it destroys that nitric oxide. This is why when you give GTN to a patient, it only works for a few minutes. So it releases all of this nitric oxide, and then phosphodiesterase comes along and it dissolves the nitric oxide. So if you want your GTN to be working continuously, we often have to put a patch on the patient, like a Transiderm patch or a nitrolingual patch or a one of those nitrate patches, a glycerol trinitrate patch. Alternatively, we have to give a patient an infusion, a continuous infusion of GTN. And that's because as fast as they release nitric oxide, because of the GTN, they're dissolving that nitric oxide or destroying that nitric oxide with this enzyme called phosphodiesterase. Now, enter the patient who has had Viagra or Cialis or Levitra, any of those phosphodiesterase inhibitor drugs. Well, that blocks that enzyme. So if we go ahead and now give them GTN, if we go ahead and now give them nitrolingual, or we put a Transiderm patch on those patients, what's going to happen is they'll release all of this nitric oxide, and there's none of that enzyme that's available to sort of keep it in check. So they get this massive, widespread vasodilation, and they drop their blood pressure so dramatically that there is a potential that they will have hypooxygenation of their myocardium. Now remember, the premise of giving GTN to these patients is often that they're experiencing an ischemic chest pain. We don't want to worsen that ischemia, and we absolutely don't want to drop their blood pressure so catastrophically that we have difficulty raising it. Please don't give GTN to a patient who's had Viagra within the last 24 hours or one of the longer-acting erectile dysfunction phosphodiesterase inhibitors in the last 48 hours. GTN will drop their blood pressure quite dramatically. Hope that helps.